up to your stomach, and you can use like a pillow or something to put in between you so it's not such personal space. And then basically you're going to tell them just to relax, and you're going to grab their leg, bring it back, and then lower it down. And that would be a negative Ober's test. If the leg hung up right here, that would be a positive Ober's test for a tight IT band, because basically your IT band starts up here from the tensor fasciae latae muscle, the coffee muscle, and then it comes all the way down, crosses the knee joint, and it attaches at Gerdy's tubercle. So again, positive would be if he hung up here, he has a tight IT band, but if it drops down to his other leg, that's a negative test. For Thomas test, sorry, I'll have you roll back on your back, I should have done the other one. So Thomas test is basically, you have both legs out, and you're basically going to ask the patient to go ahead and flex one knee up and grab your knee and pull it in towards your chest. And if the hip comes up off the table, that's a positive test indicating some hip flexor tightness or tendinitis. You have them do both sides, so they go and grab this leg, pull it up. And again, you're going to compare both sides, and if it was to pop up like this, that would be a positive Thomas test of the hip. And that encompasses the hip and pelvis. We'll move to the knee. Are you comfortable like that? Okay. So the blottable patella test is basically you have to get the patient to be relaxed enough to where the kneecap can move freely. So you're able to move it back and forth. And what you're going to do is you're basically going to push down on the kneecap and see if it bounces. Sometimes it helps to push the fluid out of the capsule down further and then push on it. Basically, his patella does not move. If it had a big effusion inside the joint capsule, this kneecap would be floating and you would be able to bounce it up and down. So that would be a positive test for an effusion inside the knee joint, which is separate from having superficial swelling from, say, a bursitis. So if you had prepatellar bursitis, you would see swelling right here, and it wouldn't be, you wouldn't have a positive blottable test, because that indicates something inside the knee joint, such as the cartilage, the ACL, meniscus, something in there tore or got damaged and made the knee swell to have an effusion, which is separate from like a superficial swelling of the bursitis. Or if you rupture or tear your lateral